Did you know that breast cancer is the most common cancer among women globally? In fact, according to the World Health Organization, 1 in 8 women will be diagnosed with breast cancer in their lifetime. And every year, over 2 million new cases are diagnosed. And while it's less common, men can also be affected by the disease. The good news is, breast cancer can be treated, and more effectively if found early. Early detection is key to improving survival rates, which is why it's so important to be aware of the warning signs. My name is Dr. Katina Richardson. I'm a board-certified family medicine doctor practicing out of South Florida, and today we're discussing the top 5 warning signs of breast cancer, exactly how and when you should be screened for breast cancer, and lastly, we're going to discuss how we can reduce our risk of developing breast cancer. So before we get into the warning signs, it's important to point out that in order for you to recognize any of these warning signs that we discussed today, you have to first know what's normal for you. Everybody is different. Everybody's body is different, and what's normal for one person may not be normal for you. It's important to know your body, know what's normal for you, and only then can you recognize when something is not normal. Okay, so let's go. Top 5 warning signs of breast cancer. So the first warning sign is a new lump or mass. A lump in the breast is often one of the first signs of breast cancer. While not all lumps are cancerous, any new lump or new mass should be checked by your doctor. Typically, a cancerous lump is painless, hard, and has irregular edges, but this can vary. The second warning sign, noticeable changes in the size or shape of your breast, especially if one breast becomes significantly different from the other. This can be a warning sign. This could include swelling, shrinking, or visible distortion. Swelling, for instance, can occur even without a distinct lump. You might notice that one breast has become much larger than the other, or that there's unusual fullness. And as we discussed before, most women have breasts that are not identical, right? So they're usually what we like to say is they're sisters rather than twins. So it's important to know your normal. If one breast has always been a little bit larger than the other, that's normal for you, and that's okay. The key here is to identify any new changes or things that are not normal for your body. The third warning sign is nipple discharge or inversion. If you experience any unexplained nipple discharge, particularly if it's clear or bloody, or if your nipple starts to turn inward or becomes inverted, it is essential to get this checked out by your doctor. Our fourth warning sign is skin changes on the breast. Look out for any changes on the skin of the breast. This includes redness, scaling, or thickening of the breast skin or nipple, or if the skin starts to dimple or pucker like the skin of an orange, it is time to see your doctor. These changes can indicate the presence of cancer cells blocking lymph vessels in the skin. And the fifth warning sign I want you to be aware of is persistent pain or tenderness. While breast pain is often related to menstrual cycles or other benign conditions, persistent pain in a specific area of the breast that doesn't go away should not be ignored. In addition to paying attention to any warning signs or anything that's abnormal for your body, regular screening is crucial in detecting breast cancer early, even before symptoms appear. The best test we use to screen for breast cancer is with a mammogram. A mammogram is an X-ray of the breast that's used to look for early signs of breast cancer. The beauty of mammograms is that we can now detect breast cancer very early, before it can be felt or before it causes any symptoms, and sometimes up to 3 years in advance. For most women, screening with a mammogram starts at age 40, and you continue this every year or every 2 years depending on your individual risk factors. However, if you have a family history of breast cancer or other risk factors, you may start screening much earlier. And in addition to mammograms, genetic testing and MRI screenings might also be recommended for those at higher risk. So it is crucial to discuss your individual risk factors with your doctor to create a personalized screening plan. Remember, early detection saves lives. The sooner breast cancer is found, the better the chances of successful treatment. Your body will often give you signs and signals when something is not right. So paying attention to these signals, knowing what's normal for you, and having regular screenings makes all the difference. So if you notice any of these warning signs that we discussed today, please reach out to your doctor. One of the most important things that you can do for your health is to establish a relationship with a primary care doctor that you trust. Having regular, at least yearly, checkups allows you to build a strong relationship with your doctor and have open and honest conversations about things that may concern you, no matter how small they seem. Your doctor will guide you through appropriate screening schedules and recommend any additional tests that may be necessary. While we can't completely prevent breast cancer, there are steps we can take to lower your risk, such as maintaining a healthy weight, as obesity has been linked to increased risk of breast cancer. In addition, staying active, limiting your alcohol intake, stop smoking, and knowing your family history have all been linked to decreasing your risk of developing breast cancer. Know your body, stay informed, and share this with someone you love. Thanks for watching.